Hello everyone, welcome to the Family and Women's Health channel. My name is Kafung from the As promised last week, today I'm going to share with you a topic, a condition that a lot of mid-aged women are dealing with, menopause. And since I have this PowerPoint presentation made up a while back when I used to work at a women clinic, I'm going to use this to share with you because, the information is not really changing much. So instead of me sitting in front of camera, I'm going to do this through a PowerPoint presentation today. So to cover this topic, we will go over the definition, what is menopause, symptoms of menopause, the causes, the prevention, and the treatment. Talking about menopause, what is this? What really happening in the woman body? This is a natural process that occurs as the ovaries age and produce less productive hormones, estrogen and progesterone. This is defined when someone is having no menstrual period for at least 1 year. And this is defined too when the ovaries stop releasing eggs and a person can't no longer having children. This can cause many changes in the body, from the mood, from overall well-being, from physical stage. And averagely, menopause happens about age of 51, but 90% is between the ages of 45 and 55. However, it may occur as early as ages of in the 30s and 40s, and then few people, for few women, it doesn't really happen until in their 60s. With menopause, there's a misconception that a lot of people are thinking if someone having menstrual period early, she will go into menopause early, and that's not true. It's not correlated, it's not related that way. Before we go into talking about the symptoms and the treatment, let's break this down a bit first. Let's go through the phases of menopause. Usually it's broken down to 3 different stages, and the process of menopause is not something that would occur overnight. It is a process that, that the symptoms start way before. Sometimes it could be from 5 to 10 years before the person actually go into menopause stage. It usually started out with varying irregular menstrual cycle in length and frequency, and this we refer to a period or a term called perimenopause, which means right before the actual menopause stage happening. And then the actual menopause is when the function of the ovaries actually ceased, and postmenopause is occur after the menopause already occurred, and usually we define it as if a person have at least 12 consecutive months of no period. Now, the symptoms of perimenopause, menopause, and postmenopause vary greatly from woman to woman. However, the most common symptoms that reported are hot flashes, vaginal bleeding, vaginal symptoms, urinary symptoms, mood changes, fatigue, stress, depression, and etc., even more. With perimenopause is actually a menopausal transition stage that could last 4, 5 to 10 years prior. In this stage, the menstrual cycle may occur more or less frequently, and sometimes a person would skip a cycle here and there, and then usually the bleeding might be lighter. And symptoms, as we mentioned earlier, it might include hot flashes, mood changes, fatigue, stress, and symptoms shown to be greatest in this stage compared to menopause and then postmenopause. Now, so we said there are 3 phases of menopause, and here I have a little chart here that will give us a little insight of what's happening in the body. So we see here in the perimenopause stage where the estrogen level is still high, but over time it would reduce tremendously, going down to postmenopausal, and the symptoms also. The symptoms here also shown the greatest in the perimenopause, and then slowly it will going down as a person move from menopause to postmenopausal. When postmenopausal is when the period is permanently stopped, and then the hormone level going down from perimenopause going to postmenopause. And it's correlate with the symptoms as well. The person would experience the most symptoms here, and then slowly actually also going down as well. Now, symptoms of menopause, we mentioned a little bit earlier, but there's a lot, and these on this chart here are the most common or the highest percentage reported. Hot flashes, defined as a sudden feeling of warmth and flushing, start at the face, then quickly and rapidly it moves or spread out to the neck and the upper part of the body. It's reported or occurs in about 75 to 80% in women. However, in my opinion, I think it might be even higher. And this symptom may last up to 7 to 8 years, with symptom persisting 4 to 5 years postmenopausal. Night sweat is also very high percentage that reported. Vaginal dryness, sleeping disorders, mood change or depression, stress, joint aches, and pains. So with menopause, how do we diagnose a person? What are the diagnoses, and how do we know a person actually go into menopause? Recently, the FDA had approved a new blood test known as Pico AMH ELISA. And this is a quantitative 3-step sandwich immunoassay in which it measures the amount of anti-Müllerian hormones, and this abbreviated by AMH. So the amount of anti-Müllerian hormones are measured in the test. This AMH level represents one indicator available to clinicians to determine whether or not a woman is approaching or likely to have reached her final menstrual period. And this test meant to be used in conjunction with other clinical findings, with other clinical symptoms, and it is not meant to be performed by itself. So a person have all these symptoms, she probably gone to the doctor to see, presenting all these clinical symptoms that we mentioned earlier. So this test is used to actually help confirm her condition. Again, it's not meant to be performed by itself. The second test that used is the blood test that measures the level of follicle stimulating hormones FSH and estradiol. So if finding FSH level of 30 MIU in a milliliter or higher, combining with the lack of menstruation, that's when we define a person to have menopause. Besides these tests, over the counter, there are saliva and urine tests available as well. However, these tests are not reliable and not recommended. So along with all the symptoms the person experience is causing her to have a lot of distress, have a lot of not quality time in her life. There are certain complications that also is a big thing that we have to worry about. This list here are the most common problems or complication that a person have to be dealing with when she go into menopause. Vulvovaginal atrophy. This is a condition associated with a decreased estrogenization of the vaginal tissue, and symptoms going along with vaginal atrophy including dryness, irritations, maybe soreness with urinary frequency. So what it really meant is it's actually the thinning a tissue or thinning layer of the vaginal layer. And because of that reason, a lot, when a person have a lot of dryness and a lot of soreness, it's also going along with a condition or a term that we call painful intercourse, slower metabolic functions, osteoporosis or weakening of the bones, mood or sudden change of emotional changes, cataracts, periodontal disease, urinary incontinence, and heart disease. So with all that great symptoms and complications associated with menopause, what can we do? What can we do to improve some of these symptoms? These are here is the non-pharmacological approach that we could use. Try to avoid triggers like spicy food, caffeine, alcohol, smoking, consuming or try to eat more foods that have more estrogen content, dress in thinner layers so that you can put more on, take them off when you need to, use fan to help cool down, and practicing relaxation techniques might help to promote that relaxation to reduce the stress and why not. Now, treatment of menopause, the most common or conventional form or drug of choice or treatment is the hormonal replacement therapy abbreviated by HRT. Now, with people who have vaginal atrophy, we should be treating this with topical vaginal estrogen. We don't use oral tablet. We don't use other form of topical. It had to be used topical vaginal estrogen only. Now, treatment of menopause are customized per patient need. It has to be individualized. It's not one size fits all. It has to be based on a person's clinical symptoms. And the goal of therapy is to relieve menopausal symptoms. There's nothing out there that can really just, treat and take that away. It's just meant to be relieve the symptoms and produce a better quality of life only. So again, overall, there are different approaches of treatment that can be used. Modification in life changes, including dress loosely and keep temperature low for hot flashes, use fan, avoiding triggers, avoiding stress when we can. Hormone replacement, estrogen versus the combination of estrogen and progesterone. This is the treatment of choice for moderate to severe hot flashes with no contraindication. And we will discuss this contraindication in a little bit. Non-hormonal treatment, antidepressant and anti-epileptics to use in severe symptoms And for people for folks who are not candidates for HRT, hormonal replacement therapy is, let's just mention this, it is used as a treatment. It's not recommended for prevention of menopause. So really it's only used in the people, in women who already diagnosed, that already gone into menopause stage. Again, it's not meant to be for prevention. And HRT available in many dosage forms. There's our oral tablet, vaginal creams. We have vaginal tablets, vaginal ring, patch, and gels. That's all available. And HRT treatment is meant to be for short-term treatment only, generally no more than 5 years or beyond age of 60. And again, doses are individualized based on severity of symptoms, based on clinical symptoms that finding for each individual. The indication of HRT is to relieve menopausal symptoms, prevention of osteoporosis, maintain quality of life for women who are candidates to use HRT, and premature ovarian failure. Some of the adverse effects of HRT that reported, these on the list here is the most common reported: breast soreness, vaginal bleedings, mood symptoms. Well, because of this is hormonal therapy, so it does affect a person's mood greatly. So 1 minute, she might be feeling okay. The next minute, she totally different. So that's just really often reported. Bloating is also another one that a lot of women are complaining about when using or in HRT treatment. Now, contraindication of this HRT for folks that have breast cancer, uterine cancer, coronary heart disease, people who previously have blood clotting, stroke, liver disease, gallbladder disease. These are the folks that are not able to use HRT. It is contraindicated, and then you will just use other alternative like non-pharmacological approach or using non-hormonal therapy for these people. Now, for non-hormonal therapy, low dose of antidepressants like the class of drug called selective serotonin reuptake inhibitors are used. Paroxetine 7.5 milligram is the only agent that has received approval by the FDA for the treatment of hot flash. The management and also other medication like Wellbutrin, Celexa, Lexapro are also used as well. However, these are really prescription medication, and you have to go see your primary doctor for them to prescribe whatever need of that might fit you. Anti-epileptics like gabapentin is approved to treat seizures. However, in this case, it is also been shown to help reduce hot flashes, and this drug is useful in women who cannot use estrogen, who cannot use that HRT, and who are having any contraindication with HRT. This medication is helping for those who have nighttime hot flashes. And clonidine is a typical product that oral tablet or patch is typically used to treat high blood pressure. It also might provide some relief in hot flashes as well. So again, These medications are prescription, and it had to be prescribing by the doctor. So when you go in, if you're not qualified for HRT, these are some of the choices that could be used. And besides the other therapies that we just mentioned, we sometimes heard of something called bioidentical therapy. So what really this is? This bioidentical is derived by soy or plant extracts. Then they go through modification to be identical to body's hormones. Many people or many women turn to this approach due to the safety concern with conventional hormone therapy. However, it is not recommended due to the lack of evidence for their safety and efficacy. There's not enough study proving that this is effective. And when tested, potency and absorption are very variable. It's it's not consistent. And safety, their suggestion that hormones in bioidentical medication might not be any different from those in traditional hormone therapy. And traditional hormone therapies don't necessarily exclude all the natural hormones. For example, some of the FDA-approved products such as Estrogen or Allura, which contain estrogen, and progesterone, a natural progesterone that actually derived from plants. So there is suggestion to go with products that are approved by the FDA rather than go with the bioidentical hormone or stuff available, just because it might not be any different in terms of safety compared between the bioidentical therapy to the conventional hormonal replacement therapy. And then besides all the one that we already discussed, there's all alternative therapies that are really promising, that might help to relieve some of these symptoms. Practicing relaxation techniques, doing yoga, doing box breathing, meditation or hypnosis. And what this really does is that it's promoting that relaxation. It helps a person to relax, to reduce the stress, and then might enhance. A person might feel better. Supplement like calcium food high in content of calcium, vitamin D, help to restore bone density. Magnesium supplement could help reduce the risk of osteoporosis, and in turn improving energy levels and promoting better sleep. Sometimes when a person have that hot flashes running, she might feel that her skin's constantly hot, constantly dry. So applying moisturizer or moisturizing lotion or cream daily to help reduce skin dryness. Managing sleeping issue, we could use over-the-counter sleep medication such as melatonin, and you can buy melatonin at any local pharmacy. They would sell them. Natural products like chamomile tea, valerian, hops, passion flowers, lavender oil, ginseng tea. These also again might help to help you relax, and it helps to promote better sleep as well. So maybe try one or try a couple to see if anything that would help your symptoms. These are natural products. It's not really having too much issue with side effects or anything like that. So it's maybe a good choice to try a couple to see if anything would help your symptoms. And then other remedies, the results for these are not consistent. But however, it's not bad to try some. Like flaxseed is really rich in estrogen content. Soy like tofu, soy drink, really rich in isoflavonoids, and this would help to boost the estrogen level. Fruits, dry fruits, red wine, nuts are known to have really high content of estrogen. So with menopause, it's very important to understand individual needs, what symptoms she likely have, and how it's affecting her her life. So again, everything is individualized. Not everybody experience the same thing or same symptoms or same condition. So seeking information to help improve quality of life would be important. Talk to your medical provider to find the best treatments that fit your need. Would be important. Share with other peers, other women, and see, it would help to relieve your stress. And hopefully, from sharing, it will help you to find a better solution that would help you. So that's what I'm sharing with you about menopause. Thank you very much for watching. If you do have any question, please leave me a comment below or email me at catphungp@gmail.com. Please don't forget to share and subscribe